Today, we're going to be talking about a tough topic. Have you just been diagnosed with a glioblastoma? Brain cancers are particularly scary, and people are led to believe that there's no options that they can use. And I just want to show you some research that I've been reviewing by a physician and researcher who I greatly respect, Dr. Thomas Seyfried. I'm going to share with you some of the results of one of his studies and then point you to his research to read for yourself. Thanks for stopping by, everyone. This is Dr. Tidman. This is going to be a brief video, and I could have a 2-hour video on the use of the ketogenic approach in cancer. This is merely a summary. I'll be posting more videos in the future on this topic because the research in using the ketogenic therapeutic approach in cancer is really booming. So we're going to overview just briefly some principles of ketones and their anti-cancer effects. We're going to discuss briefly ketone metabolism and the ketogenic diet for cancer. And I'm going to give you some resources, refer you to them because they will go in much more detail. And then I'll give you my tips and takeaways, as I always do. So I want to direct you to this research study by Dr. Thomas Seyfried et al. It's really talking about cancer as a metabolic disease. The theory has swung to cancer only having genetic causes in the last few decades. But Dr. Seyfried maintains that cancer really is a metabolic disease. So there's a concept of the seed and the soil that I want to just review briefly. The seed concept is the genetics, it's the genes. That's the problem. Genes mutate, and that's where cancer comes from. That's one school of thought. Another school of thought is the soil. It is the presence of metabolic dysfunction in the entire body that is the origin of cancer. You see how different those two sides are? So there are arguments for both sides. But Dr. Seyfried believes that if you fix the soil, then you give the body a fighting chance. Now, that's not to say he doesn't use chemotherapy in his cancer treatment with his patients. He does. But he feels like, and the theory is that if you can fix the soil, the body, get the body strong, get it resilient, get it adapting, that even the chemotherapy you use will be more effective. We'll go into more of that. So I want to talk about the Warburg effect briefly. Cancer cells rely on aerobic fermentation, which means they burn sugar inefficiently and produce lactic acid, but they thrive on glucose. They would rather try to use glucose for their fuel source. It's interesting to me that in order to diagnose cancer, what do? They do a PET scan. And a PET scan is an imaging technique where they infuse into your bloodstream glucose with some tag items, and the cancer cells light up on the PET scan because they want the glucose. They thrive on pulling in that glucose. So it's interesting to me that that's how they diagnose a lot of cancers. Again, one school of thought, cancer is a genetic disease. Another school of thought, cancer is a metabolic disease. And some physicians and researchers like Dr. Seyfried really use both concepts in their treatment. So, what we're trying to do is to target the tumor's fuel source, which is glucose, right? Cancer cells do not survive in the presence of ketones. Ketones are considered toxic to them. This is a general statement, but it's generally true that if you get your body changed over to running on ketones, your immune system will have a fighting chance. Ketosis gives you a metabolic advantage if you're a cancer patient or struggling with a glioblastoma or other forms of cancer. Seyfried's research points out that many of these tumors can ramp up with glucose and glutamine. It makes them harder to control. Dr. Seyfried's work builds on the work of Dr. Warburg, and he understands that if you can really change the metabolism to more of a ketone fuel source, that this opens the door to a different type of cancer therapy. So the ketogenic diet was used in cancer treatment for decades. And along about 30 years ago, it fell out of favor because of all of these new cancer drugs. In my opinion, it doesn't have to be one or the other. It can be a marriage of both to give you the maximum benefit. The fascinating part is that brain cells can thrive on ketones, but the cancer cells in your brain cannot thrive on ketones. So again, this gives you a metabolic advantage. The main concept in a keto for cancer type of diet is a calorie-restricted diet. We call it KDR, ketogenic diet restricted. Now, typically, the ketogenic diet, we don't ask you to restrict your calories. You just eat until you're satisfied. But again, in cancer treatment, we are looking for ketones to boost to very high levels. Therefore, a combination of the ketogenic diet, restricting calories, and fasting all brings about that significant elevation in your blood ketones. We know that this state of high level ketosis reduces the formation of new blood vessels into the tumor. So it begins to kind of starve the tumor. That's what we want. It also is an anti-inflammatory approach. It encourages cancer cells to kind of self-destruct. Wow, we'd like that in our arsenal, wouldn't we? And of course, it lowers your glucose. Again, we're hitting your cancer cells with all the metabolic advantage we can hit them with. So this calorie-restricted ketogenic diet, which is lower in protein than I typically recommend for ketogenic diets, is anti-angiogenic. That is, you get less of a formation of blood vessels to feed those cancer cells. It's anti-inflammatory, bringing down the inflammation that may be driving your cancer cells. And it encourages cancer cells to self-destruct. That's what we want. So what does this mean for you, the patient? While ketogenic diets aren't the standard of care, they used to be, but they're not anymore. Seyfried's research and his clinical trials are showing great promise in improving the quality of life and survival outcomes for those with glioblastoma and other cancers. Unlike chemotherapy or radiation, metabolic therapy strengthens the whole body, reduces your side effects, and empowers you to take control of your treatment through nutrition. Imagine a future where the ketogenic diet approach is brought back into cancer care for a total approach along with chemotherapy. It's a science-based integrated approach. Now, I'm not suggesting that cancer patients abandon their standard treatments. But Seyfried's work shows us you can use nutrition as a powerful medicine through a ketogenic diet that is calorie restricted and some fasting regimens to boost your ketones, strengthen your body's defenses. So while you're having chemotherapy, you're getting the best of both tools in your arsenal. I hope this approach provides you with some hope. And I also hope you can find an oncologist who will work with you to build in a metabolic approach along with your cancer treatment. So remember, some of the tips and takeaways I give you on my channel apply to cancer treatment. I think the only one that doesn't is typically I'm asking you to raise your proteins to 25%. But in a cancer diet, you want your proteins down around the 15% level. You really want to boost those ketones. And as you bring your proteins down, you'll really raise those ketones. Obtain a meter so you know what your ketone levels are. Try to fast 24 or even 48 hours before your chemotherapy. People aren't going to think that's a very popular approach. In fact, most doctors, oncologists are telling you eat whatever you want. But what I'm telling you is the ketones you produce in your bloodstream will really boost the effectiveness of the chemotherapy. It'll weaken those cancer cells. So by the time you hit it with the chemotherapy, there should be a bigger effect. This is kind of in a nutshell. I love the book Keto and Cancer. And look up that book. I believe the author is Kalamian. You can find that book on Amazon. I think her approach is very practical, gives you lots of specific details about what you can do. Miriam is her first name. I just thought of it, Miriam Kalamian. And she has done a lot of work with Dr. Seyfried's group. So thank you for joining me for this very difficult topic. I'll have more in the future on keto and cancer in different cancer diagnoses. This one really dealt briefly with glioblastoma, brain tumors, brain cancers. Check out Dr. Seyfried's work online. And remember that a well-formulated ketogenic diet can help not only with your metabolic health, but it may be able to give you some more tools, more ammo in your arsenal to fight this cancer you're dealing with. I'm so sorry you're dealing with this cancer. It breaks my heart for you. Leave comments below and let me know how I can help. Remember to subscribe, and I'll see you on my next video.